Back pain. It's one of the most common reasons Americans miss work, lose sleep, or simply struggle to enjoy daily life, right? In fact, nearly 8 out of 10 of us will experience it at some point in our lives. So we're all looking for ways to prevent back pain or find an effective way to treat it. And today we are diving into the spine to give you tools to protect your back for the long haul. Joining us now is Dr. Gregory Strock, a physiatrist and pain management physician with Franciscan Health. Thanks so much for being here.
Well, thank you for having us.
Okay, so physiatrist, I have to confess, I've never heard of that before.
It is a smaller medical specialty. Half the training in residency is typically inpatient rehab, such as spinal cord injury, traumatic brain injury, and the other half is usually musculoskeletal, spine care, and pain management strategies.
And what are you, is there another name for your title?
Physical medicine and rehabilitation is the other name for the specialty.
Okay, so what are the most common causes of back pain? What do you typically see?
The most common cause is really a non-specific cause of back pain. Most bouts get better with no specific treatment or are self-limited and resolve in 3 to 7 days. So most common causes is really uncertain source of pain. But the more common causes of specific pain are sprains or strains and disc problems, joint problems, and nerve problems.
What are we doing to, unknowingly sometimes, to make it worse, to aggravate these problems?
One of the most common things that people aren't aware of that can contribute to it is smoking.
Really?
Significant obesity are things that many patients aren't aware of that contribute to their back pain. Also poor biomechanics with lifting and bending, twisting activities.
And what about posture? We've always heard, that if you're not sitting up straight, that can create back problems.
Yes, posture is important. Much of what we do in our day-to-day lives is in front of us, our computer screen, our keyboard, our phones. So much of what we do causes a forward flexed posture with our necks flexed and our shoulders pushed forward. So one of the things we need to try and be cognizant of is keeping our posture aligned with our ears over our shoulders over our elbows and hips.
Do you recommend for someone who maybe is sitting at a desk for 8 hours a day, is it best to go ahead and stand up every once in a while?
Yes,
Does that help the back?
Taking a break and doing some stretches where you stretch your chest muscles and work on getting your shoulders back in alignment is good habit to get into, a few times a day anyways.
At what point should I see you for back pain? What are some red flags I should be looking for?
Red flags typically are the concerning ones are that might even prompt a visit to the emergency room rather than seeing me would be unexplained weight loss, especially in the setting of cancer, fevers, chills, night sweats, especially if there's been a recent systemic infection such as an untreated urinary tract infection. True loss of bowel or bladder function, meaning you cannot control your urine or stool, or you're unable to empty your bladder, especially if there's coexisting numbness, tingling in the saddle region. Progressive leg weakness, significant weakness. Also, if there's been a history of trauma, such as a fall from a height, especially in an elderly individual, or a significant motor vehicle accident. If those are more mild, certainly we can see them in the office, but the loss of bowel or bladder function, the history of trauma, often will necessitate being seen in the emergency room.
So there have been people, and I know people in my own life, who have had chronic back pain, and it's almost as if they've resigned to thinking that, this is just something I have to live with. What do you say to those people?
I say to those patients, most of the time we can improve your pain. Not always can we completely resolve it, so we have to have reasonable expectations depending on the patient, but most of the time it can be improved significantly and improve their function in life.
And how so? What are some of the options?
Many patients haven't had any conservative care when I see them, so physical therapy is usually the starting point, and trying to identify the source of pain. So specific treatment is geared towards a specific source of pain. So most importantly, trying to identify the true source of pain. As I mentioned, many cases are non-specific, but those that persist, we want to try and identify the source of pain. If physical therapy doesn't help, help, often further imaging and injections if needed, and occasionally surgery.
Okay. So what is one simple change everybody watching today can make to protect their spine health?
I would say one significant change people can make that's not necessarily simple, but is adopting a healthy lifestyle. Okay. So healthy body weight, not being a smoker, but biomechanically, many people have heard of lifting with their legs, things like that, but also twisting, repetitive twisting and ballistic activities can be contributory.
Okay, and last question. Somebody mentioned spine triage, which is something that Franciscan Health does. What is spine triage? How does that work?
Spine triage is a referral avenue where we try and accommodate patients with acute pain within 24 to 48 hours. And the referrals, if it's more chronic, they can be put into a regular referral slot to see us. But if it's a truly acute problem, we try and accommodate them within 24 to 48 hours. So it's a single number. It's 317-528-BACK that the patient can call and then be put in the right position.
All right. Dr. Gregory Strock, thank you so much for joining us. Thanks for helping us out and helping us stand a little taller today.
Thank you. Thanks for having us.